The example of that is I have shoulder pain. There's an action that it's preventing, which is maybe sleeping. So I'm a little bit more tired. So shoulder pain equals action. Action is maybe not sleeping as well. Maybe that's not doing workouts. Maybe that's not doing whatever job. The next thing is, well, if I'm sleepy, if you're anything like me, I'm a little bit short with my kids when I'm tired. I don't show up at work as much as I should. I'm maybe a little bit less good at communicating with my wife when I don't have that. So I can start to get to the level of selling someone of being a good father, selling someone being actually a good leader because they're showing up for them there, a good husband. I just feel like I couldn't get them to open up, or I couldn't really feel like I could dig a little bit more to kind of have it more impactful conversation. Those are the ones that we want to really dig in on. And so if you just start doing that alone, you can pretty much solve 99% of your issues of asking the right questions, know why you're asking them, and then actually listening back to your stuff so you can iterate on it. I will tell you the one thing that you will struggle with doing is, as you listen to these calls, you're going to want to dig into 5, 6, 20 things of all the things that you're like, you could have done better. We're going to have to refrain ourselves because if you've ever had a front office person or a provider maybe that are having a little bit harder time with sales, maybe it's because you're looking at some of the aspects of maybe someone won't want to do a copay. They don't want to do a certain time. They don't want to do a certain exercise. They don't want to buy a high ticket cash package. There's a lot of things where this can kind of show up, or you kind of see the things that maybe you don't quite see. And that's someone dropping off after visit 3. That's someone who just never leaves you a review. It's not because it's someone that maybe doesn't leave you a review because maybe they're not as bought into the process, and normally they give reviews everywhere. So there's a lot of these hidden things that we're not seeing, and there's some of it that's more obvious. And so a lot of times we have to figure out, how do we actually go from someone who's maybe struggling a little bit with their communication to get someone to actually move forward with something, and how do we actually identify when maybe that's not the right fit, and best ways to do that. And maybe we need to replace them, maybe we need to re-onboard them, maybe we need to just have better accountability in place. And so I'm Dr. Joey Allbritton with Rehab CEOs. We work with over 275 clinics around the nation, and we have trained hundreds of front office and hundreds of providers at this point. So we have seen ins and outs of cash, hybrid, and in-network clinics, and all the things where people kind of start to fall short. And so in this video, I want to make sure that I can kind of make this a little bit more simplified. We'll start with front office, and then we'll kind of get into the provider side. So if we're looking at the front office, one of the things we really start to look at is, one, do they even know what good looks like? Do they have an actual framework of this is how the call should go? Do they know the things that are important on the call? Do they know why they're asking it? If I had to delineate one thing, most people have a checklist or a half-baked script or framework or something like that, but they truly don't understand why they're asking those questions. And so if someone says, well, how long you been dealing with it? They're like, I've been dealing with it for a while. It's just something that won't go away. They're like, oh, that's it. That's good enough. Check. Go on to the next one. We need to know exactly how long. We need to know exactly why this is now important to them, why it's urgent to them. We're not getting into some of those aspects. Or if someone says, oh, like I've had shoulder pain, well, what is it preventing them from doing? Not only what is it preventing them from doing, what are the things that it's making them not do that's making them miss out on some type of identity they want to be? Easy example of that is I have shoulder pain. There's an action that it's preventing, which is maybe sleeping. So I'm a little bit more tired. So shoulder pain equals action. Action is maybe not sleeping as well. Maybe that's not doing workouts. Maybe that's not doing whatever job. The next thing is, well, if I'm sleepy, if you're anything like me, I'm a little bit short with my kids when I'm tired. I don't show up at work as much as I should. I'm maybe a little bit less good at communicating with my wife when I don't have that. So I can start to get to the level of selling someone of being a good father, selling someone being actually a good leader because they're showing up for them there, a good husband. There's all these things that we can start to label people as. And so we're no longer in the same caliber as pain meds, or no longer in the same category as the crappy PT meal down the street. We're selling not just shoulder pain relief, we're selling them how they can be a better dad. So if we don't understand what is a good answer and how to get them to something, that's stuff that we really have to look at across the board to really make sure that we are selling them on the right things. So show them what good looks like, have a framework so they actually follow it, make sure they actually are following it. So how do we do that? We actually turn on call recording. So if you are not using call recording, it is 2024. This has been widely available for a while. And so this would be like professionals playing football and they just refuse to watch game tape. Like you would literally get fired as an athlete not watching game tape. And so your game tape is your communication as a front office, your communication as a provider. So we need to start reviewing these things so that way we can actually really make sure that we're having good communications. We're empowering people to be able to do that and transforming someone who maybe isn't as good of a lead to someone who's actually motivated to actually want to do it. And so you have to start to look at these things as like, what's good? How do we actually hold someone accountable? And then from there, what do we need to do next? We need to give them feedback feedback. And so one of the easiest things you can do is, I say, review at least 3 of your front office phone calls a week. If you're having issues on the front office, you can lower that cadence if y'all are completely crushing it and you're not having any issues. But I will say everything is cyclical. Just like when you try to teach someone billing 6 months later, you're like, why are we still having the same billing issues? Just like when you try to start to lose weight, you start to exercise, you fall off. Well, that's things that you want to do. You want to be in better shape. So why would we expect things that they don't even really care about be immediately taken and they never have to be trained on it again? And so for front office, start with 3. Typically it's 1 that went well, that actually finished their plan of care. So that way we know what good looks like. They see all the tone changes, the questions they asked, the funny, maybe small little jokes you say with some of those things, or some of those things that you'll notice. That's what we feel like when we're on a hot streak. We want to make sure we reiterate and don't reiterate and actually just duplicate that over and over. And then from there, we want to make sure we get 1 that maybe you talk to them, you're like, I feel like that went really well. And then for some reason they didn't show. That's the one that we really want to go in, because usually there's like, we didn't get into where they're at, where they want to be, what's preventing them from getting there. And the big one is urgency. Most people don't get urgency. And we want to start to look at like, what are we missing there? Or sometimes it's the tone. Like I have a lot of people who will use the words like might, maybe, some of those things that lack confidence. Or sometimes we have like an upward inflection. It's like, well, we could, I mean, this is what we do. Like people have that upward inflection kind of question mark at the end. This is very common, especially if you see someone like you've maybe had a significant other tell you, was that a question? Like if you've ever been told that, it probably means you probably have a little bit of lack of confidence in the way you say it. Or I have a couple people, that's just part of their accent. So that's just how the tonality of their dialect kind of pulls into English as they've done that. And they don't realize that's a thing until I've actually brought it to their attention. Or when someone says they can do it time, it's like, I could probably make that work. They have no certainty in actually saying it. They have no certainty that you can actually get them better. And so we have to start to look at those things. And then the last one is someone that we straight up, like we talked to them, we couldn't even get them to schedule. I'm not talking like the one that you like call, they like got the wrong number. Like there's no reason to like do an audit there. It's the ones that we have to go in and be like, okay, like that one, like I just feel like I couldn't get them to open up, or I couldn't really feel like I could dig a little bit more to kind of have it more impactful conversation. Those are the ones that we want to really dig in on. And so if you just start doing that alone, you can pretty much solve 99% of your issues of asking the right questions, know why you're asking them, and then actually listening back to your stuff so you can iterate on it. I will tell you the one thing that you will struggle with doing is as you listen to these calls, you're going to want to dig into 5, 6, 20 things of all the things that you're like, you could have done better. We're going to have to refrain ourselves, because if you tell them 5 to 20 things, then 1, they're going to be beat up and feel like they're never going to be good at it. But 2, if we give them all of those things, what'll happen, it's just like if you were to prescribe someone 15 actual exercises to get better and fit for physical therapy, the likelihood of them doing that and being able to balance it and know what's more important than the other is slim to none. And so we need to just only really praise the things that are good, and then double down on just one thing they need to focus on. If all they did was fix this, for many people, it's actually conviction when they talk to people, because either they don't believe in the product, they were just yelled at by someone on the phone, they were just talking to an insurance company that was terrible, they were just having an issue with one of their staff members, so then they're not really focused. They've had 500 of the same calls, so they're just tired of doing it. They don't come in with the same level of energy, even though that's the first time that patient's had that actual opportunity to have the conversation. Those are the things we need to look at, so that way we can make sure that we can prevent those from happening. And I would much rather us role play those things and actually go down all this aspect of fixing it, versus that being someone who now is having a surgery because we didn't train. That's someone we lost the revenue because we didn't actually train our front office. Because 9 times out of 10, it's not the front office fault. It's the fact that we don't have any systems to actually get them to where they need to be, or the owner doesn't have enough bandwidth to do that. And so we really have to look at those things so we can really expedite this. And then from there, we really just want to make sure that we actually only focus on role playing with the issues that we're having. We have a lot of people who will try to role play the entire call, but if all of your issues are when you start to talk about actual insurance coverage, then we probably just need to double down on that. If you feel like your discovery is not good and we're not really getting deep enough to inherently know why it's important to them, well, then talking about scheduling and pre-booking and doing all that stuff doesn't matter, because we're not even going to get there. It's not going to matter, because when we start to get objections on the back end, what ends up happening is we say, let's learn all these objection overcomes. And it's good to have those. Those should just be memorized, very easy, like go to. But a lot of these can be prevented on the front end, so you don't have objections. So we really want to focus on that as the big emphasis, so we can really impact as many people as we can. And then when we get into the providers, they need to do all of the same exact things. I'm sure your first reaction is, well, how do I actually do reviews like that? that because I don't have call recording. Record the audio. The way you do that is you're going to actually talk to them, specifically evals. You shouldn't really fall into this as much with visits and stuff like that. But for your evals, you actually just ask for permission. It's like, hey, like there's nothing worse than when I go to the doctor and I talk to the front office, I talk to the nurse, I talk to the doctor. Every single one of those asked me the same exact question. And so I don't want to do that for you. So would you be okay if I actually was to record the audio of this? So that way I can reference this and have really good thorough notes. So that way when you come back in, we're even more prepared in case for any reason we need to give it to anybody else as well. No one's ever going to be like, yep, I'd rather you bother me. You positioned it as a benefit for them. And then now, yes, we don't have some of the video and some of that type stuff, but we can hear the tone changes. We can hear the fact that we were so far in our own head trying to figure out what was wrong with them that we didn't actually dig enough on some of that. So look at some of those things. And again, role play with your providers, role play with your front office. Listen to game tape for both of those, and I think you'll be shocked at how much higher your conversion rate can be and how many less new patients you actively need. And so if this was helpful, we have full training inside of our school group, which is a free group where we have over 350 videos on sales, marketing, hiring, you name it. And we do 2 free group coaching calls a week. So if you have like, hey, specific questions, hop on. We're just going to be there to help you on those. Those are absolutely free. So if you want more content like this, make sure you watch our other videos, and I'll see you on the next one.